So, you've been told that your child has dyslexia, or maybe you suspect it, or you went to a parent-teacher conference and they mentioned the D word, and now you're in super investigation mode, searching the web for answers. When you do that, you're most likely going to find long lists of the common symptoms of dyslexia, and these lists are full of often conflicting things that really as a package don't make sense. I've just got a couple of them here. You might read things like children with dyslexia flip, skip, interchange common words, make random inconsistent mistakes when reading, get the little words wrong, get the big words wrong, not recognizing a word that has literally just been read, atrocious spelling, B and D confusion, doesn't show a dominant hand preference until primary or elementary school, holding their pen or pencil in a weird way, having trouble copying information from the board. And then it starts to often get into this kind of more conflicting area where things aren't really adding up. So you'll read something like, children with dyslexia have trouble saying rhymes or reciting sequences like days or months of the year, yet they have a strong memory. You might read things like, children with dyslexia have confusion with spatial orientation, like telling left from right, yet you'll also read they are highly visual, spatially aware learners. How does that add up? You might read that they're somewhat distractible, but also able to hyper-focus on things, that they are unmotivated or labeled often as lazy, yet they work twice as hard as their peers in school. I mean, it all is really confusing and hard to see how it adds up. How can so many symptoms relate to one single thing? And how could a dyslexic child possibly exhibit all of these? Well, of course, the truth is that they don't. Children with the dyslexia label simply have a reading difficulty which is not explained by some kind of intellectual disability. They are sort of normal kids who are mysteriously finding it hard to read. And the truth is that all of these symptoms you read about actually relate to usually one or more underlying causes of dyslexia. So what's underneath the label that's actually causing the dyslexia is what's really important to pinpoint. Because once you do that, you can actually target how to fix that difficulty and hopefully eradicate it so that the child is no longer struggling. Most interventions for dyslexia don't really help you do that. Some of them do, so make sure in your research that you're really looking for programs that have questionnaires that invite you to kind of drill down to what's actually underneath that dyslexia label. Look at the actual reading patterns you're seeing and relate it to something neurological. So are you seeing an auditory processing weakness? So that would be things like blending difficulty, some more of that linguistic processing trouble. Are you seeing something that comes out of them being a visual spatial learner? That would be like guessing short words, memorizing books in the early years, visually, just word for word, can spout them off at age 4 or 5, and yet those small words they get wrong constantly when they're just reading something fresh. Are they showing signs of an eye tracking problem? Skipping words, losing their place, needing to use their finger. These are just some examples of the actual main causes of reading difficulty that underlie that dyslexia label. You can read more about that on our website, dm-ed.com, for David Morgan Education. We can give you a questionnaire where you can match up the symptoms you're seeing with what might be underneath those. And we also have a program that we run for dyslexic children that tries to drill down to what's really going on, fix it so that your child can fulfill their potential in life. I hope that's been helpful.